Okay, hi there. My name is Jen. I'm going to be doing an assessment on your newborn. Congratulations on the birth of your little baby. He is absolutely precious. So just looking at him right now, he looks fantastic. His tone is great. His coloring is good. Um, he is in no obvious signs of distress. His respiratory rate is good. Nice and symmetric. I don't notice any abnormalities on his skin. So I'm going to start the exam. I'm going to go head to toe. So I'm going to start at the top. I'm just inspecting his hair, the hair pattern. He's got a great head of hair, by the way. I'm looking for any skin discolorations, bruising, lesions, such as from if he had a scalp electrode on. I don't see anything abnormal. Next, I'm going to palpate his anterior fontanelle, and I'm just feeling for depression, which could be a sign of dehydration, or bulging, which could be a sign of extra intracranial pressure. I'm also going to palpate the posterior fontanelle, and it also feels normal. Now I'm checking the suture lines, and I'm checking for any overlapping or molding, and I don't feel anything there. It would be normal if that were to happen. Next, looking at his face is cranial nerve number 7, which is the assessment of the facial symmetry. The nose is midline, no facial droop to either side. The inner canthus of his eyes are evenly spaced. They're not too far apart or too close. The outer canthus of his eyes are equal to the pinna of his ears. The conjunctiva are nice and pink, and the sclera are nice and white. No obvious signs of drainage or exudate. I'm going to look at his ears. The pinna is nice and round and symmetric. I don't see any signs of periauricular sinuses or skin tags. They're not set too low because they are even with his eyes. The pinna are nice and firm, and if I press forward, they recoil nicely. I'm going to check the other side. Same thing here, nice and symmetric. He does have a little asymmetry here, but I think it was probably just positional from being in utero. Nice and firm pinna, nice to recoil, no sinuses or skin tags present. Now looking at his nasal septum, it's nice and midline. Both of his nares appear patent. If I block one off, he will still breathe. And then same thing on that side with no distress. His lips are nice and pink, no signs of circumoral cyanosis. His buccal mucosa is nice and pink. The gums are intact, no Epstein pearls that I see. The tongue is moving nicely, that is cranial nerve number 12. Then, what else? Oh, I'm looking at the palate. The hard and soft palate appear intact. I don't notice any signs of a cleft there. Next, I'm looking at I'm gonna elicit a rooting reflex right here. This is cranial nerve 5. So you see how he's moving his head towards my face. I'm gonna put my gloved finger in his mouth, and I'm eliciting a sucking reflex. He's got a nice, even, coordinated suck. I do see swallowing. That is cranial nerve number 10. And as I take my finger out, he is now crying. I'm sorry, buddy, but his uvula is moving nicely, and that is cranial nerve number 9. I'm also going to check his tongue for tongue tie, so let's just look under your tongue. I don't see the frenulum is a good size. It's not too close to the tip of his tongue, so there's no obvious signs of a tongue tie. And then the upper frenulum, there is no signs of a lip tie as well. Next, I'm moving down. I'm going to look at his neck. I'm looking for webbing, which I don't see. I don't see any masses or lumps. The trachea is midline, and no protrusion of the thyroid gland. Next, I'm looking at the clavicle. And over here, nice and even, no crepitus noted, no asymmetry there. Now I'm looking at his chest, equal expansion when he breathes, I'm looking at the areola, which are equal bilaterally. Now I'm just going to palpate the areola. And they're about 1 centimeter size breast buds there with no obvious signs of drainage. No accessory nipples that I see either. Now I'm going to take a listen to him. Oh, I'm going to actually go back because I did not look at cranial nerve number 2, which is pupils. I'm going to just check those for light accommodation. 1 there and 1 there. Perfect. They are equal and reactive. Next, I'm going to check his red reflex. 1 and 2, holding this about 6 inches away from his eyes. Now I'm going to take a listen to his breath sounds for 1 minute. This is all I have, and I'm going to improvise and pretend it's a stethoscope. I'm going to listen here. Perfect. Nice and clear to auscultation, no adventitious sounds. And now I'm going to listen to his heart sounds with both the diaphragm and the bell of the stethoscope. This is the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to do the same thing on this side. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Excellent. No rate was nice and regular. No murmurs noted there. Now I'm going to feel his humerus. No signs of fractures there. I'm going to check his elbow range of motion, which isn't great. Now I'm going to elicit the palmar grasp. So he's curving right around my fingers, which is perfect. He's got 5 fingers on each side. No signs of webbing there. Now I'm going to look at his square window, we call this. So we bend his wrist and his hands, and it's a nice shape of a square. And then the same thing there. And then I'm going to do some arm recoil. Very good. Now I'm going to check the scarf sign, where I'm going to take this one arm and touch his shoulder. Nice resistance there. Very good. And same thing on this side. Nice resistance there. Now I'm just going to take a listen, palpate his brachial pulses, not listen. Okay. Very good. 2+, nice and regular on both sides. Now I'm taking a peek at his abdomen. I'm looking at the color, the skin. I don't see any bulges, masses, distension, or does not appear to be sunken. I'm going to listen to his bowel sounds. Good. Good bowel sounds in all 4 quadrants. Now I'm going to do some light palpation. Now I'm going to do some deep palpation. Sorry, buddy. Okay. Now I'm going to palpate his liver. Good. It does not feel enlarged. And now I'm going to feel his femoral pulses. Very good. Nice and equal bilaterally, 2+. Now I do have a little baby boy here with male genitalia, so I'm looking at the shaft of the penis. It is symmetric. If I lift it up, the chordae running down the center is midline. I'm looking at the urethral meatus. It is at the tip with no signs of an epispadias or a hypospadias. The scrotum appears symmetric. No signs of a hydrocele or excessive rugation. Now I'm just going to palpate the testes, and I'm going to start by running my hands up into the inguinal canal and working my way down. 1 and 2. Very good. And now I'm going to inspect the anus for patency, which it appears patent, and I believe he has already had a bowel movement. Now I'm just going to turn this little guy over. Good. I am going to inspect the back. It looks great. No signs of any rashes, lesions. discolorations, no Mongolian spots or anything like that. I'm going to listen to his breath sounds posteriorly. Very good. Now I'm looking at his spine. It's nice and symmetric, runs down the middle. I don't notice anything abnormal about it. I'm going to do his truncal incurvation reflex. Sorry, that's a mouthful. I'm just going to run my finger here, and his trunk will curve. And same thing on that side. I'm looking at the sacral dimple. There is nothing there. If there was a sacral dimple, we would want to assess for the base of it and make sure it was closed, and if not, refer out for an ultrasound. The gluteal folds are nice and symmetric also. Good. Now I'm looking at the lower extremities. They're nice and even in color. I don't notice any lesions. They're nice and range of motion at the knees, so he's got a good range of motion. They're nice and symmetric. Next, I am going to check the toes. We have 5 toes with no webbing. 5 toes, no webbing. Now we're going to do the plantar reflex. Very good there. And now the Babinski, and the toes open nice and big. Perfect. And now, popliteal angle. So this one is hard to do with this particular little guy, but I would put the legs, and they would be a 90-degree angle with the legs. Now I'm going to do the heel to ear, heel to ear. And now I'm going to assess his hips for any hip clunks. So, well, first I'm going to check the knees, and they're nice and equal in length. And that's the Alice sign. And then I'm going to adduct or abduct, and that is the Ortolani sign. And then I'm going to adduct, and that is the Barlow sign, and that appears normal. So we have a normal newborn exam. Thank you.